Well, welcome very much to your OBGYN rotation. I can definitely tell you that the residents here and the faculty here have a really strong vested interest that your next 6 weeks with us are very good, that you walk away and that you really feel like you've learned a lot. Certainly not all of you probably are interested in obstetrics or gynecology, but I can guarantee, since women do make up 50% of the population, you will take care of women in your practice no matter what specialty you choose. And so that this is definitely a very important time as women will be part of your practice. So quick question, how many have had the opportunity to perform a pelvic exam on a person? Oh, this is pretty good. Most of you guys, terrific. How many have had the opportunity to have a pelvic exam performed upon them? There's always a wise ass guy in the crowd, always. All right, terrific. All right, good to know. So I would just encourage you, and certainly I don't want to show up on the news or anything like that later, so all of you gentlemen, I would encourage you to go into an exam room, pull the footrests out. I think they should be called footrests. We're not riding horses here. Pull the footrests out, put your feet in there, scoot your rear end to the bottom of the exam table, let your knees just fall open, nice and relaxed, and see if a mantra of relax, relax, relax helps you at all in this very vulnerable position. All right, so I think we do ask very personal questions in obstetrics and gynecology, but remember the questions that we ask are very important in helping guide what exam you want to perform, what services you're performing. So keep that in mind. I don't say, gosh, I'm really sorry. Do you have diabetes in your family history, right? And I also, on the same token, don't go, I'm really sorry, can you tell me how old you were the first time you had vaginal intercourse? And I think it's really important that we watch the word language, the word that we choose. I certainly have heard lots of slander, like I've got something going on somewhere. Sometimes I've asked people to point to the part of the body they're talking about, you know. But remember, you want to use appropriate word choices, and you really want to watch your language, especially in the pelvic exam. This experience this morning is very well received. We have 2 women who actually, well, they don't really volunteer, they're being reimbursed for their time, but they actually provide you with the opportunity to be in a pelvic exam experience where we can talk, really become very comfortable, and they provide really good feedback so that you know that you're providing a really good exam, okay? We do this for twofold reasons. You know, if you were gonna be working with me in clinic, I'd wanna know that actually I've seen you perform a pelvic exam and I know what you're doing. And the same token, when the patient looks at you and goes, have you done this before? You can say yes, all right? And so that's equally important. So, okay, quick question. When you walk into that exam room, whose responsibility is it to make the patient feel comfortable in this interaction? Yours. It's your responsibility. Good, good. What's a good way to immediately kind of enhance that know me, like me, trust me when you walk in the door? I suggest smiling. It's a smile. It's not a hard thing, okay? I think some of the best lessons I've learned in life came from my grandmother. Treat other people like you would like to be treated, okay? When you walk into that exam room, anticipate that that's your family member on the other side of that exam experience, okay? You're the one with the knowledge. You're the one to help them feel very comfortable and very at ease, all right? So, quick question for you. When do we start doing pap smears? At what age do we start pap smear surveillance? Excellent, good, great, you guys got it, terrific. So you walk into the exam room, hi, I'm 17, and you've asked me, of course, what age I started having intercourse. I started having intercourse at 16. Are we gonna do a pap smear? No, terrific, good, excellent. Because what does a pap smear screen for? Cervical cancer, great. What all can we screen for when we do a pelvic exam? G-Syn chlamydia. Good. So I'm 17, I've had intercourse for a year now. I've had 3 lifetime partners at this point. Are you concerned about my exposure to gonorrhea and chlamydia? Good, excellent, yeah, good, you should be. Terrific. So what about vaginal discharge? Is vaginal discharge abnormal? No, the answer is no. All women have vaginal discharge. In fact, I tell them, if you know, all women have vaginal discharge. If you say you don't, you're lying. No, I'm kidding. But what things about vaginal discharge are concerning? Itching, to hear itching. Itching's good, yeah. A bad smell, good. Bad odor, itching. Increased amount, maybe change, terrific. So if someone comes to you and they say, gosh, I have this really increased vaginal discharge, has this really bad odor, what different things are on your differential diagnosis? What are you thinking? BV, bacterial vaginosis, great. Is BV sexually transmitted? No, when you go, and how do we diagnose BV? Wet mount, terrific. We go look underneath the microscope, terrific. So you go look underneath the microscope, you walk back in the room, and you say, you have bacterial vaginosis. What should immediately the next sentence be out of your mouth? It is not sexually transmitted. Good, excellent, very good. Her eyes will be this big. So terrific, good. So how do we test for gonorrhea and chlamydia? A swab, good. We can also do urine screening as well. There are definitely some parameters about that. So terrific, okay. So we have some young woman who's come to see us. We believe that based on the questions, her history, that it's appropriate to do a pelvic exam. You want to go ahead and get that patient positioned. A few things to keep in mind. Certainly we see women who have visual disabilities, hearing disabilities, maybe mobility disabilities. They probably did not just acquire those on the way to your exam room. I think the best way to ask someone how to help them is to ask how to help them, all right? Again, you want to watch your language choices. And so we'll have the opportunity to perform this exam, but I just kind of want to walk through these different steps with you. So someone's positioned on the exam table. If you're in labor and delivery, it is a bed. So I think it's appropriate to call it a bed. When you're in an exam room, it's a table. Again, just really be conscientious about the language choices and the words that you're using, okay? Usually we've done a complete annual exam. You've probably listened to their heart and lungs, felt their thyroid. You've performed a breast exam. Usually you want to just be careful not to say, and now for the fun part. Now the patient may say now for the fun part. You see where I'm getting at, you know? So again, just those word choices.